Ublalotag, Kanuik Pizzy. Today is Friday. What day? All day today. Let's be responsible. Always try, do our best, cooperate with others, and let's treat everyone with respect, including ourselves. Today we're going to take a moment to talk about Omicron. Do you remember Delta? Last fall, Delta was the dominant variant of COVID-19 that was around. Now we have the Omicron variant. What's a variant? It's when a virus changes itself a little bit, and they give it a name, and that change creates a whole new strain of the virus. Well, Omicron showed up on December 1st of last year, and a month later, by January 1st, 95% of the cases in the United States were Omicron. Two things stand out about the Omicron variant of COVID-19. First, it's more infectious than the other variants. And second, the symptoms are actually less severe. Okay, let's consider more infectious. What does that mean? When something is infectious, that means you spread it from person to person. Well, with Omicron, you will spread it, if you get it, to 2 to 3 more times people than you would with one of the other variants. Less severe. Let's consider what that means. Well, that means fewer people will get really seriously ill, which is great. So then you might wonder, why do we care if it's less severe? Well, we care because it's so infectious. So many people might get it, and you might spread it if you get it to a lot of other people, and you might spread it to somebody who will get very sick. There are people who are immunocompromised or who have other medical conditions that can still get very sick from Omicron. Let's take a look at who's actually being hospitalized from Omicron. Well, if you look at the people currently in the hospital with this variant, 63% of those are not fully vaccinated. About 29% of those are vaccinated, and only 8% are vaccinated and boosted. So wow, look at that. 2/3 of them have not been vaccinated, and only a small 8% are ones who've been vaccinated and boosted. This is some really good evidence for how vaccinations and getting boosted can protect you from getting severely ill. When the Omicron variant of COVID-19 starts spreading all over in a community, there's a phrase for that, and it's called community spread. Community spread means that people don't really know how they were infected. Now, some of you have been close contacts, and you know when you're a close contact, you were exposed to the virus. With community spread, people are like, gee, I'm not sure. I don't know. Where did it come from? Who was I by? And it's confusing. And in community spread, you see the virus show up in surprising ways that are not connected. Let's see what this looks like. Typically, one person might get sick and pass it to 3 more people who pass it to about 8 more people who pass it like that. It's all connected. And community spread, one case pops up, another case pops up, another case pops up, and people aren't sure how they got it. There's probably a pretty good chance that we have community spread here in Brevig because we have cases in a number of households that are not connected. It's possible. So what can we do about that? What are things we can do to protect ourselves? Of course, there's masking. And people are saying now that a mask like this, a KN95 mask, or just a 95 mask, are some of the best masks you can wear. You'll see some people who've been ordering them online are showing up with different kinds of masks. If the best thing you have is a cloth mask, there are things to look for a good cloth mask. It should have more than one layer, like these masks that we have more than one layer. You can pull the layers apart like this. So it should have more than one layer. It should be hard to see the light through it. That's a good thing. And it should cover your face completely. All the way here and all the way around here. You should feel it on your face. There's other good masks too that have wire in them. If you have one of those, you can press it around your nose so it covers even better. Now, we've talked about this before. Is this wearing a mask? Not really, is it? It's a fake wearing a mask. Why bother to have it on? It's like wearing a chin protector. So now, while we have Omicron, it's really, really, really important. You wear your mask and you cover your nose. You might not know. It's all over. It's all over in Alaska. You might not know if you have it, and you might be giving it to other people without meaning to. So that's very, very important. The other things you should do is stay home when you're sick. The first couple days of Omicron can look like a cold. If you feel like you have a cold or think you might have a cold, that's a good time to stay home and to get tested. If you have symptoms like that, make sure you plan to go to the clinic and get a test done. Also, you should mask indoors whenever you're around people. So you may be wondering, with all this Omicron going on in our region and the possibility of community spread, why is the school open? Well, the school is open because students need to be learning, and school needs to be a safe place for students, and that's why we mask. That's why we ask you guys to sit apart. That's why we ask you guys to wash your hands and use hand sanitizer a lot. We want it to be a safe place here in school for any family that wants to send their children to school. There are kids who have already had COVID recently. There are children who are vaccinated and are safer, and there's a lot of people who want to be in school. That's why school is open. We are going to have cases of Omicron in our community. It's going to be spread around, and the best thing you can do is do the safety procedures you know how to do. I know we're all tired of COVID. It's exhausting, isn't it? All we can do is follow safety procedures and work hard to take care of each other and be kind to each other and get through all this together. That's the best thing we can do. Keeping school open is part of making things as normal as we can make them. And remember, there's also the responsibility upon different people to take the prevention of things like getting vaccinated, getting boosted, and wearing your masks at the right time. So let's hang in there together, guys. Let's get through this. It's not going to last forever. It is tough. We all know that. But let's support each other and do the best we can.